I'm Matt Delvecchio. Thank you for tuning in here on a Sunday, mild day today. Now, did you know that almost 1 in 4 Canadians are caregivers? Almost all caregivers are unpaid, and they were most likely thrust into the role of caregiver with no formal training. It certainly can be stressful, exhausting, and overwhelming. And as we age, more care is required at home. However, it's putting enormous strain on our healthcare system. In fact, the number of people waiting for home care through the CLSC has more than doubled in the last 4 years to over 20,000 people. That's right. There are more than 20,000 people in the province waiting to get home care from the public system. Some families are waiting it out. Some adult children are actually leaving their jobs to help out. Spouses of a loved one are really involved, much more than they felt they could handle. And other families are actually choosing to go private. Well, to help guide us through these muddy waters, I'd like to bring in Kirstin Bennett, Managing Director of Premier Home Care. She's also a certified professional consultant on aging. Kirstin, welcome back to Life Unrehearsed.
Hey, Matt. Thanks so much. Always happy to be here.
Well, thank you for coming on the show again. I know you are one extremely busy person and really appreciate you taking the time. You are a wealth of knowledge. And so let's get right into it. Now, the majority of Canadians want to age in place. And as our population ages, aging in place can be more challenging. So what are some of those challenges that families are facing?
Well, there are many, some obvious and some not so. But for me, the biggest challenge is being able to explain how to create an environment that is safe for this to happen. Really, it's all about safety for me. Ideally, people will think about that as the foundation and, be able to come together with their family members to understand what that actually means. So whether it's home modifications, medication management, emergency alert systems, proper nutrition and hydration, proper hygiene, there's on and on, socializing, transportation, and the financial preparedness for it all, really. Other challenges, there's a denial challenge, when no changes are being made. And that can be sometimes general personality factors, fear of change, even health issues that make it difficult to see that the situation for really what it is. And I suppose, also challenging is the increasing caregiving responsibilities and burnout issues that we're seeing more and more of.
Seeing a lot of that, and this is probably the biggest concern because, as mentioned, it's you're kind of put into this role, and inevitably care needs increase, and that caregiver role becomes more and more responsible, and you and I both see that burnout happening. So I want to get into, we do have our healthcare system. It gets a little confusing. So can you explain the difference, Kirstin, between public and private home care?
Well, that could be answered in so many ways. But the thing is that, public is oftentimes there's a waiting period to get public home care. So if you don't already have an established dossier, you can call a private home care company, and the support can be provided in a shorter period of time, sometimes with a day or two, depending upon the circumstances. I think the main difference that people always seem to think about is cost, which I completely understand. Although private home care does have an hourly expense, the time and energy put into managing public home care situation also comes at a cost, I believe. So, and with public, you also, don't always have that backup, what you might have when you have a team of care coordinators working on your behalf through the private system. Sometimes the need for support can change really quickly, and the reaction time is often quicker within the private home care arena. And I think ultimately I would say that you probably have a little more control and say within the private home care situation.
All right, listen to Life Unrehearsed. Matt Delvecchio here, and I'm talking about aging at home, or as we sometimes call it, aging in place. And I'm with Kirstin Bennett, Managing Director at Premier Home Care. And you're bringing up a good point. I think if our healthcare system was doing what it's supposed to be doing, we'd all be getting home care through our local CLSC, obviously the most cost-effective way. There are challenges with the CLSC, with different caregivers and so on. But let's face it, that's what we would want first. So for those that want to access home care services through the CLSC, Kirstin, what is that process?
I guess it's, there's many kind of ways. If there's a hospital stay, you will typically be provided with an opportunity for the public home care support. I say typically because it's not always. So my advice is really to be sure to advocate for it if it's not being offered. If it's not upon hospital discharge, then, to have an in-home assessment by a social worker or a nurse case manager to have a file opened is basically what we're looking for. And there are a few ways to do this. For example, it can be done by directly like a request from a family doctor. The individual themselves can make the request, or a family member can call the guichet d'accès, which is like the point of access for their region. They can go to the local CLSC. And if you're in immediate need, sometimes, you can go through calling 811 and speak to the social service specialist there. And always, though, to manage expectations, it is rarely immediately available. So please do understand that you're going to expect some delays and wait, but continue to really check in and advocate. It is at times, tirelessly frustrating. But sometimes it works out very well for families once they're on the radar. And it really seems like everyone's journey is different, but there's multiple ways to try to go about it.
And one of them is, we know about a labor shortage. This is part of the challenges with the CLSC. One of the government's answers, which is actually a good idea, it's just a matter if they can execute properly, is a program called Chèque Emploi Service. Now, what does that mean?
Well, it's the support services from the Health and Social Services Network are sometimes made available via a financial allowance granted through this program. So this allowance is allocated to you by the Health and Social Services Center that assessed your needs and established a plan specifying the number of home care service hours you are entitled to. So rather than the CLSC sending different caregivers, you can choose the person who will provide the home care support with a subsidized rate. You do have certain responsibilities with this program. We don't really have enough time, I don't think, to get into all the details, but for instance, you're responsible for choosing the person who provides you with the home care services, so finding them, interviewing them, doing background checks. You'll be responsible for organizing and scheduling the work to be done according to the number of hours that are allocated to you. You need to be able to explain and describe the tasks to be done. And then there's like a volet. It's a form to provide sort of the payment process. And, with Chèque Emploi Service, some families choose to use these hours in total or in combination with additional hours within a home care company. So like Premier, for example, the home care companies oftentimes can work within that program as well. They have coordinators who can help you set it up, provide the pre-screened caregivers. And the program itself is currently more available these days in some regions than others. It's somewhat under revision, primarily due to the budget cuts right at the moment. Yeah,
for sure. And like you say, you can do a combination. If you only get minimum hours for Chèque Emploi, you could top it off with private lead. Premier Home Care, like you say, does that quite a bit. We're quickly running out of time. However, I want to talk about some government tax credits that are available out there to assist families because it is costly for private home care. So how does the government support the private sector with some credits?
Right. So there are some tax credits that can assist families. The home support tax credit, for one, to be eligible for that tax credit home support, you must be 70 years or older, a resident in Quebec. And, if you meet these, you can claim tax credits regardless of your level of dependence. So this is a refundable tax credit, which means you can receive it even if you don't have any income tax to pay for the year. So basically, if you turn 70 during the year, you can claim the tax credit for those expenses paid in that year after you turn 70. Yeah, and if you're a dependent, you can look into a dependent sort of assistance. There's also, for caregivers, there's Quebec and federal governments that are trying to provide some level of financial assistance. So people should look up the Canada Caregiver Tax Credit, the Quebec Tax Credit for Caregivers, the Société d'Habitation du Québec that has a home modification program. You can do some medical expenses on your taxes. Assistive devices can be claimed. what's really important is for people to investigate it further with an experienced accountant, and to do some information gathering.
Yeah, the little Google searches, but there are some credits
Yeah.
out there. It's
Yeah.
encouraging. All right, thank you, Kirstin. I'm going to ask you to stick around if you don't mind, because you've
Sure.
provided some guidance and support to many families, including those that need that roadmap for effective elder care planning. So I want to tackle many of those discussion points and topics that you talk to families about.